You nervous?
A little.
You're a little nervous? Yeah. I'm not as bad as I was last time. I noticed when we hit start, the camera kind of, because we're on this really shaky app thing.
Oh.
It doesn't
Is it?
matter.
Oh, yeah, look, it's chasing my head. The little square. Do you see it?
Yeah.
Okay. Why isn't it tracking your head?
Oh. It did it for a second.
Oh,
When
is it
you
because
look
I'm
away,
talking?
It knows who its owner is. That's got to be what it is. Or is it blah, 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 blah. No, that's nothing to do with talking.
It's probably who the better looking one is where
my
this
hands.
is where the square goes. Hello.
Hello.
Norm.
Hello, Claire.
Welcome back.
Welcome back.
Welcome back.
Glad
if
to be
anyone
back.
is now following, this is our second episode of Between
Two Lamps.
Two Lamps.
Yeah.
There's actually 3.
7. There's a lot
There's
of lamps.
actually 7, yeah.
I hate fluorescent lights, so.
Yeah, I feel that. So this is our second go at just a little collaborative discussions, 2 different disciplines of wellness and healthcare, and talking about something that is sort of fundamental across the board that every person experiences, and certainly is a huge crossover between our 2 professions, where is this concept of chronic pain, but every time Norm says chronic pain, I'm like, pain in general, right? It's important that we understand all of it, right? And chronic pain is one little piece, very misunderstood, very, important, and a lot of facets underneath it, but the true how we start changing the narrative and helping people is that we just break down pain in general.
Yeah.
And then we start being able to say, okay, well, your pain is classified in this way.
Yeah.
And we can drive treatment in a much more productive precision therapy type of way.
Yeah.
So
Yeah. And we were just talking a little bit about language a minute ago before the camera started. And so I want to piggyback off of what you just said, that we know that when we begin to use language to describe our human experience, we actively shift our brain activity from the right hemisphere to the left hemisphere.
Oh.
The left hemisphere is where the language center of our brain is. And that's important for a couple of things, because when it's on the right side of our brain, generally speaking, is speaking with the language of emotion and intuition. And so things can be vague and amorphous, and they can be larger than what they might be.
Mm-hmm.
And then when we use the left brain is skilled at analysis and quantitative descriptions of reality. And so it takes that big amorphous emotion and it condenses it down and it gives it definable parameters. And so to say to someone, and we see this when somebody gets a diagnosis, sometimes diagnoses are a way of treating. And it's like, oh, I know this is what's wrong with me. And you can relate. Suddenly you feel this
validation.
Yeah, relief. And now like, okay.
Well, you get a directive plan of care. You get resources. Right. Yes.
Yep, that's right.
But a diagnosis, it's funny because I don't know if you watched my bit. I don't know if anyone watches my video. But the last video that I was doing was about this diagnosis of SI joint dysfunction, and somebody had specifically reached out about that, and I had to take probably an entire 10 to 15 minutes to say, while it's so important that we quantify and specify what that means, oftentimes in the pain world and in the physical, the physical manifestations of pain or dysfunction, it's so much bigger than that.
Absolutely.
So while a diagnosis can be so helpful, it can be validating for I have a child with a genetic epilepsy, which had we not gotten a specific diagnosis for that, and we just called it epilepsy or idiopathic epilepsy, it would not get the specific treatment that she needs to be doing as well as she is. So a diagnosis can be so important. I actually texted with a friend this morning too about, it's the same thing for imaging, right? In my world, people, if they come up to me and they're like, I've got this knee pain, and I should probably just go get an MRI. And I'm like, while any sort of objective measures
Yeah.
and blood work and images and all of that can be really helpful.
Right.
They can also tell a story that has actually nothing to do.
Yeah,
I mean,
that's right.
specifically with the pain world,
Yeah.
that it's like if you get an image of anything, you're going to see something like that. The radiologist is going to be like, let me tell you everything that may be problematic here, right? And then that can create that can then set you off on this path that has nothing to do with what's actually
That's right.
happening in your system.
Yeah.
So it's a complicated thing. And I was telling Norm, like, as I kind of start to reflect on what next year, I always try to come up with a word or an intention for the year. And it just is all around this idea of words and language and how we've can either weaponize words and language, or they can be so good and beneficial. And so what does that look like in the medical world? Like, how much can we change the trajectory of people who have been so mismanaged by just giving them a better understanding of what's happening in their body, instead of saying fear-based language that maybe validates them in an instant, but then sets them off. So the example I always use is like, if you're a physician who is still saying to a patient, you have the back of an 80-year-old, and that patient is not older than 80, which in that case would be, great, I have a back of an 80-year-old, I'm 85. Right. That's the idea of how we've misused language. So instead of taking that minute to talk about normal age-related degenerative changes, the fact that, yes, your genetics, also what you do in your life and how much mileage you've put on your body and what you do for a living and your repetitive movements and all of that contributes to how your spine looks at whatever age. We're going to throw that little tidbit out there, and then we set off this very fear-based.
Right. And when we say like set off a fear-based, like what's happening like in the nervous system is that now there's a threat that maybe wasn't there before.
For sure.
Because whereas before I noticed I had some pain in my body, but now you said I have the back of an 80-year-old. Well, I know 80, that's towards the end of life.
Sure.
And so I'm thinking like the life as I know it is now over.
Right.
And from this point on, it's going to look different, which may be factual in part.
Right.
That I need to make some changes and stuff. But now I have different nervous system responses that are having an entire cascade. So now I'm having arguments with my wife. Now I'm not being, patient with my kids.
Well, and then you're convinced that there's no hope there. There's nothing that's good. So then, when you look at the biopsychosocial model of healthcare, which I would argue is even missing the spiritual, the energetic, so like the consciousness, the even bigger holistic, and you've got all these layers to our pain experience, or how we feel at any given moment. And now you've added a layer. So that person is going in with trying to get an image to validate and calm the threat.
Yeah.
And now we have validated the existence of, a really severe, right? An 80-year-old, that's a really severe image. Yeah. So now that threat level has gone up. And then you've added this, another element of like, the quality of life and all of the people that that are on disability because they had the back of an 80-year-old, and so you've just added more threats.
So let's qualify for those of you who are watching and learning. We're using a lot of language like that you may not have the same scope and context of definition. So when we say threat, and when we talk about our body's response to threat, like from a nervous system standpoint, What do we mean when we say something is threatening? What's happening?
Okay, so this is a great, just sort of the basis of our pain experience, our stress experience, the way we internalize some bit of information in our environment. So I think last time we talked a little bit about, our body is taking in information from our external environment and our internal environment, and it's sending it through the system up to the brain. The brain decides, is this important? Have we been here before? So that is happening across the board for benign little things that, I go and, I use the example, I walk outside and it's chillier, I go get my coat. Just an easy, like, I know that this is important, I'm going to do something about it. But even the more important things, right? And all of us are taking in information, and when something is meaningful to us in a way that is potentially threatening to my life, my health, how I'm able to work, how I engage with my children, how I connect in a greater, then that's going to be perceived in that nervous system response as, we need to do something about this, right? So we've all heard of the like adrenaline fight or flight response, right? So I was just telling Norm, and actually, can you tell me when I first walked in what you asked me?
Oh gosh, I don't remember.
About your neck.
Yeah. So I asked her. Whenever I get really stressed, I have my neck seizes up and gets tight. So I have really limited mobility, and it's pretty painful. And I asked her, why is that? What's going on? And
I was like, well, turn the camera on.
Let's talk
about it. But in that same vein, so I often describe to patients that we cannot separate the mental and emotional stressors. So you did not have a car accident recently, or you didn't fall and hit your head or throw your neck out. You've picked up on a pattern that every time you're too stressed, right? You get out of your window of tolerance. That's a Norm phrase. That it responds with this very physical presentation. And the reason being is that your nervous system doesn't dissociate. Here's a mental and emotional stressor. Here's a physical stressor. We got hit by a car, or the response is the same.
Okay, so this is a really big point. So from our nervous system, it's not making a distinguishing between the emotional and mental stressor or the physical environmental stressor.
It does not.
But from a nervous, they're the same. It's the same data.
Yes.
Okay.
So that is to say that when we talked about last time that, like, an ankle sprain and the mechanism, the inflammation activates, and then the inflammation is an irritant. So we got chemoreceptors or chemical receptors that are picking up, and it's creating more of a, hey, you should probably get off of that, you should probably wrap it. So the same, a chemoreceptor is different from a mechanoreceptor or any other type of receptors. But the way the body responds, if the brain believes this is a threat for any reason, the response is, I'm going to do something about it. I'm going to fight. I'm going to fly. I'm going to, whatever. And some of that is an output of pain, right? And so in your case, I would say that the way that there's probably a physical history in your neck that your tissue remembers, and that your nervous system has created a tag to that old injury, right? Or that old, this is where I hold my stress. Everybody has a place that they hold their stress, right? And so your nervous system is predictable enough now to know that if I hit this threshold of threat, my neck's going to tighten up.
As a way of guarding against that threat coming to light.
That's right.
That being realized.
Right.
Like, oh, what we thought was going to happen has happened. Danger's here. We need to guard ourselves.
Yeah. So in your world, in the trauma world, how we can say that people will connect an experience with like a sound or a smell, and those sounds and smells, when taken away from this experience, are benign. But now they're connected here. So the same thing has happened in your nervous system that has there's a connection, right? The nerves that fire together wire together. So like that's your pattern now, right? The other bigger picture part of that is, I often say, like, if you ever have a cold or the flu, or like your body's kind of fighting something off and you feel a little achy, you're going to feel most achy in the places that you've had an injury. Because there's a tissue memory there. There's a reactivity. So my nervous system says, hey, remember what happened that time? So it senses that, like, what's my immune system doing? We better alert the troops. So it starts to highlight.
It's like an attorney citing precedent, It's like, Hey, look, we need to worry about this because citing Brown versus Smith,
Right.
You remember that softball game you played? So.
Right. Yes. Exactly. You said attorney, and I blanked out. So
cool.
How does that feel?
Yeah. So our body is not distinguishing between different stressors. Our nervous system.
Yeah.
And that information comes in, and it triggers the memory in my body of where I've been wounded or had pain before. And as a holistic, systemic response to that possible threat, I tighten up, I inflame, I guard. And then on the emotional side of things, I have anxiety, I have racing thoughts, I am short. And so, I pray less, or I pray more, or there's an entire like biopsychosocial spiritual.
Yes.
It's like when you're playing Minesweeper and you hit
I love Minesweeper
and it
so
like
much.
Clears like 10.
Oh, it's such a good feeling that.
Yeah.
And then you get the red X.
Yeah.
No,
Let's talk about how the red X makes.
I know, right? Well, and you bring up a good point. There's a beautiful graphic that I use in just about every presentation I do with stress, and it's like there's this mental and emotional negative spiral, right?
Yeah.
And then this physical spiral, and they're so connected. And the root is, the center is pain, right? And we can have mental and emotional pain, we can have physical pain, but those systems are so connected that one makes the other worse, right? Okay. If I'm someone who has chronic pain, chronic low back pain, and there are times where it's more manageable, the moments that I'm more stressed out, just with life, the overwhelm, my pain is worse.
It's worse.
Because we've ramped up that same system, right? That system that is designed to be protective. It's designed to alert us. And if we're not listening, to alert us even more.
Yeah. So I see this when I'm working with chronic pain clients with EMDR, is that it's almost like when we shift the attention away from how the pain feels in the body and to a positive experience. In this particular case, I'm thinking of, the lady was thinking of her son's birthday party, and it was a wonderful birthday party. They were at the beach, and it was great. And I asked her, and right now, do you feel any pain? No. In this moment, I feel no pain. And it's like she could direct her attention to think about the pain and remember the pain, and the pain would return.
Sure.
But, if I cut my hand off, I'm going to feel the pain no matter what I'm thinking about, because there's an active wound that's like, and so I think for just noticing that, like in this particular case, the direction of attention was really powerful in her experience of the pain in the moment. So,
and such a beautiful representation of regardless of what's happening in the tissue, where you actually maybe have, we're talking physical pain, actually have tissue damage, things that are healing, there is always the biggest part of our pain experience is the nervous system. Mm-hmm. It's not the tissue. Yeah. And so that's why things like that can happen. Yeah. That's why in a moment when your thoughts are directed a certain way, or you mentioned the TENS unit, right? Yeah. The way TENS works is it gates pain, meaning it sends a message that's benign and non-threatening, a tapping, a buzzing, and it overrides. It's a quicker delivery to my nervous system than the threat. Yeah. And so while that's on, and while she's focusing on a positive memory, the nervous system is not threatened.
And so, this is 20 minutes. We're gonna land the plane next week. We'll continue this. Ask questions, comments. Let us know what you're thinking. Next week is the 23rd. No, is it?
Yep.
Okay, we may skip next week because
I'll still be here.
I won't be here.
I'm gonna just show up and demand to be sitting in this chair.
But we'll catch up with you in the new year. Let us know what you're thinking, and we'd love to hear from you. So.
All right. Great. Good job.
Ready, break.